Melbourne Arm Clinic is an upper limb surgical specialty practice. So we specialise in anything from the shoulder, elbow, wrist or hand.
Generally, you find that the patient will call up on our 1300 number and make an appointment. If it's fracture, we make time to see it because we understand that it can't wait for that long.
Once you arrive at Melbourne Arm Clinic, you'll be greeted by a friendly staff at reception and asked to do some paperwork and patient registration. You will then come in to the consulting room for diagnosis, assessment and investigations, and we go through a detailed history and examination to try to best diagnose the condition. In the suite we have access to an ultrasound machine if we need further clarification of your condition, and we also have easy access to pathology and radiology services in the same building. Once an accurate diagnosis is made, we can start instigating treatment options, which are often non-operative. If your condition requires an operation, we will go through the operation with you. I will then introduce you to the practice nurse who will spend time with you whilst at Melbourne Arm Clinic going through the operation, organising your operative date, as well as optimising your health before surgery.
Also draw them a diagram of what the anatomy of the area is to reinforce what they see on the x-ray. And then I go on to models. For example, this is sort of a model of the whole upper limb, and say this is a wrist fracture or a scaphoid fracture. I tell them where the scaphoid is to start with. So I tell them, it's this little bone here, this is a scaphoid. Your fracture is right across here. What's wrong with the scaphoid? What's the blood supply of the scaphoid? And I reinforce that by telling them of what implants actually go into their hands. So I show them the sawbone bottles which got all the implants already imprinted in them, so that they can have a look and understand what we are planning to do.
When arriving for your surgery, please proceed to the reception desk at Ringwood Private Hospital and notify staff of your presence. Once checked in, you'll be taken through to day of surgery and you'll be seen by one of the hospital nurses, where further paperwork will be completed and you'll be asked to change into theatre clothes for the day. In the anaesthetic bay, you will be seen by the anaesthetic team, which includes a nurse and the anaesthetist, who will go through the anaesthetic requirements. Most shoulder operations are done under a general anaesthetic, but you will also have a drip inserted into the back of your hand. In the anaesthetic bay and before your operation, we will see you to go through the procedure once again with any questions that you may have before we start your operation. After surgery is completed, you'll receive a phone call from the clinic staff within a few days to ensure that your pain is minimal, that you understand the post-operative instructions, and you've started with the early physiotherapy exercises. During this phone call, we'll organise your follow-up appointment, as well as ensuring that you have appropriate physiotherapy appointments as part of your rehabilitation.